Examining birth control methods. Abstinence is the most effective method to ensure that you won't receive an unintended pregnancy or get an STD. Some people define abstinence as not having sexual play with their partner. Others say you can have outer course with your partner but no actual vaginal penetration. Again, when you're doing something like this, it can lead to temptation of actually having sex. And some define it as not having intercourse when a woman might ovulate. This is described as periodic abstinence or the rhythm method. This is not an effective method because a woman may have irregular cycles and could ovulate at any time. Again, the best method to ensure that you won't get pregnant or get an STD is abstinence. Birth control pill. You take a pill each day to prevent pregnancy. It's safe, effective, and convenient. Easy to get with a prescription. It cost about $15 to $50 per month. The hormone in the pill works this way. If it has estrogen in it, it keeps the ova from actually ovulating. If it has progesterone in it, it makes the cervical mucus thicker so the sperm have trouble actually getting up into the uterus. There's some side effects that you see here from taking the pill. If you have any of these side effects, then the pill may not be correct for you. Birth control shot, Depo-Provera. It's a shot in the arm that prevents pregnancy. It's safe, effective, and convenient. Again, you have to have a prescription for this. The shot lasts about 3 months, costs about $35 to $75 per injection, plus any fees the doctor might charge you. How does it work? Well, by getting the high doses of progesterone, it keeps the eggs, again, from leaving the ovaries, and the cervical mucus will actually thicken, and the sperm can't get up into the uterus very well. There are, again, some side effects that may occur from this. One of the most common ones is irregular absence of actually having your menstrual cycle. Again, if any of these side effects cause any problems, then this form of birth control may not be right for you. Birth control implant, Implant-On or Nexplanon. It's a matchstick-sized rod that's inserted in the arm to prevent pregnancy. Again, it's safe, effective, and convenient. It must be inserted by a healthcare professional. The cost is between $400 to $800 up front, but lasts about 3 years. Again, the ova won't ovulate, and therefore the woman's also her cervical mucus will thicken and will keep the sperm from getting up in the uterus. Again, we have some side effects that could occur. If any of these occur while you're on an implant, you want to discuss it with your, of course, your care provider, and you may have to have the implant removed. The birth control patch, a small patch that sticks to your skin that prevents pregnancy. It's safe, effective, and convenient. It's easy to get, again, with a prescription. Costs about $15 to $80 a month. The same hormones in it that the birth control pill has, so it works the same way. If you're an active person, you may have trouble keeping the patch on from sweating and perspirating, say a female athlete or something. There are some side effects that may occur, and it's the same side effects that the pill has. If you have any trouble with these side effects, again, you may want to no longer use this form of birth control. The vaginal ring or the NuvaRing. It's a small ring placed in the vagina once a month for 3 weeks to prevent pregnancy. It's safe, effective, and convenient. Again, you have to have a prescription for this. It costs between $15 to $80 a month. The NuvaRing works like the pill. It carries the same possible side effects, so if you have any problems with that, contact your physician. And you may want to quit using the vaginal ring as a form of birth control for you. You do have to insert it up into your vagina all the way up to your cervix. Birth control sponge. Today's Sponge is a name brand. It's a foam sponge inserted in the vagina to prevent the pregnancy. It's supposed to be safe and convenient, easy to use. Costs about $9 to $15 for a package of 3 sponges. The sponge covers the cervix and blocks sperm from entering the uterus. It also releases a spermicide to keep the sperms from moving. As you see, there's a little string on the back side of it that you can actually pull it out afterwards if you're done using it. You shouldn't use this if you're allergic to any sulfur drugs or actually the products that make sponge, polyurethane or some type of one of the spermicides. If you have a history of toxic shock syndrome or reproductive tract infections, obviously this is not for you. The side effects are associated with the allergies to spermicide and polyurethane, and some people experience irritated tissue around or inside the vagina. If any of this occurs, again, this form of birth control may not be right for you. The cervical cap or the FEM cap. It's a silicone cap inserted into the vagina to prevent pregnancy. It's safe, effective, and convenient. It lasts up to 2 years. The cost is about $60 to $75. The cervical cap must be used with a spermicidal cream, jelly, or jelly to be effective. The cervical cap blocks the opening of the uterus, and the spermicide stops the sperm from moving if they come in contact with it. The cervical cap cannot be used during menstruation and may be difficult for some women to insert up inside their vagina all the way up to their cervix. It may be pushed out of place by some men, of course, that have larger penises or some heavy thrusting during sex or certain sexual positions, so you have to be careful using it. Must be in place every time a woman has vaginal intercourse and may need to be replaced with slightly larger cap after pregnancy. Side effects. It's related to allergies to latex and spermicide again, and the tissues around the vagina or inside could be irritated. If any of this occurs, the cervical cap may not be the right form of birth control for you. Condoms. Condoms are made of latex and plastic. There's lots of different forms of them. They prevent pregnancy and sexually transmitted infections. They can be used as another form of birth control for extra protection. They're safe, effective, and easy to get. They cost about $1 each, but are sometimes available for free at health clinics. You're supposed to wear them on the penis. This catches the male's ejaculation. They keep the reservoir tip a little bit extended from there to ensure that it has room to catch the ejaculation. Side effects are usually associated with allergies to latex, if these exist, and there are some lambskin ones out there made, but these are not very effective from preventing STDs. If you have any problem with the condom with latex and all, this may not be the right form of birth control for you. Condoms pre-lubricated with minoxidil 9 are also helpful in preventing the AIDS virus. Minoxidil 9, of course, is a spermicidal agent which will prevent the sperm from being able to move. The diaphragm is a shallow silicone cup inserted to the vagina. It's safe, effective, and convenient. It lasts up to about 2 years. Cost is about $15 to $75. The diaphragm must be used with a spermicidal cream or jelly placed around the edge of the lip of the diaphragm when it's inserted. The diaphragm blocks the opening to the uterus, and the spermicide stops the sperm from being able to move. For the diaphragm, for some women, they have trouble inserting it. And again, the same issues concerned with the cervical cap about it being able to move around, so you have to be careful. It must be placed every time a woman has vaginal intercourse, and it may need to be refitted for any weight loss issues or weight gain issues, or if you become more physically unfit. The side effects are associated with latex allergies and spermicide. If any of these occur, again, the diaphragm may not be the right form of birth control for you. Female condom. It's a pouch inserted in the vagina to prevent pregnancy. It catches the male ejaculation. Again, it reduces the risk of sexually transmitted infections. It's safe, effective, and convenient. It's easy to get. They cost about $4 each. The side effects, again, are allergies to latexes. It could cause an irritation of the vagina or the vulva or the penis. It slipped in the vagina. It might slip into the vagina during intercourse. If you're having any of these kind of problems with a female condom, then it may not be the right form of birth control for you. The IUD. It's a small T-shaped device inserted in the uterus to prevent pregnancy. It's safe, effective, and long-lasting. There's two types, Paragard and Mirena. They must be inserted by a healthcare provider. They cost between $500 to $1,000 up front, but they last up to 12 years. Both types affect the way sperm move so that they can't join within the ova. Mirena may prevent the eggs from leaving the ovary. Paragard thickens a woman's cervix mucus. The mucus blocks the sperm from actually joining with the ova, getting up into the uterus. Side effects, as you see, there are several side effects associated with the IUD. If you experience any of these, then this may not be the right form of birth control for you. The morning after pill, Plan B, or one step. This is emergency contraception. The birth control is used to prevent pregnancy up to 5 days or 120 hours after unprotected sex. It's safe, effective. It's available at most health centers or drug stores. The cost varies from $10 to $70 per dose. Plan B contains progesterone. 2 doses are required. One step contains another chemical in it that may prevent or delay the ovulation. They may interfere with the fertilization of an egg. It's also possible that these types of emergency birth control pill will prevent the implantation of a fertilized egg in the uterus by altering its lining. It doesn't work if a fertilized ova is already embedded in the uterus. There are some side effects associated with Plan B or one step. Again, this is not a form of birth control to be used on a regular basis. This form of birth control is to be used as a form of emergency. And say, for example, a condom is ripped or something of this nature. Spermicides. It's a substance that they're made of jellies, creams, foams that prevents pregnancy by stopping the sperm from moving. They're safe and convenient, easy to use. They cost about $8 per pack. The spermicides are inserted deep into the vagina shortly before intercourse. They block the cervix so sperm cannot reach the egg. The spermicide will cause the sperm not to be able to move and they can't join with the ova. Spermicides may not form a good barrier over the cervix. They may make the spermicide less effective. Some women complain that spermicides are messy, they leak from their vaginas. The side effects are allergies associated with spermicide. They may irritate the penis or the vagina. If any of these occur, they may not be the right form of birth control for you. Vasectomy, sterilization for men that prevent pregnancy. It's safe and effective. The cost is anywhere from $350 to $1,000. Vasectomy blocks each vas deferens and keeps the sperm out of the ejaculatory fluid. This is done by cutting and sewing together the vas deferens tubes. The sperm are absorbed by the body instead of being ejaculated from this point on by white blood cells breaking them down in the epididymis. Side effects sometimes are infections after the surgery. This surgery is actually meant to be permanent. Males will not be able to ever have kids again. This procedure has been reversed, but it's very, very expensive. Tubal ligation. Surgery prevents pregnancy. It's safe and effective. It costs between $1,500 to $6,000. The fallopian tubes are cut at the ends, burned together with lasers, or sewn together. This prevents the ova from getting to the uterus. The ovas are now absorbed by the female's immune system. The white blood cells will break it down in the upper third of the fallopian tubes. The side effects, sometimes there's infections after surgery. This is meant to be permanent. Females will not be able to have kids again. This procedure is reversed, but it's very costly, and there can be more dangers of ectopic pregnancy from scarring around where the fallopian tubes have been sewed back together. Again, this should be a permanent form of birth control. Withdrawal, also called coitus interruptus or the pull-out method. It's safe, easy, and convenient. It's where the male pulls out of the vagina before he ejaculates. This method is not effective because the pre-cum has sperm in it, and some males don't pull out early enough. Side effects, no protection, of course, against any sexually transmitted disease. As I always say, ensure that you have names picked out for your children if you're going to use this as a form of birth control. When a couple decides they want to start partaking in sexual relations, they need to make sure they have the right form of birth control for them so that they don't have an unwanted pregnancy. 0 out of 100 will actually get pregnant from abstinence. Of course, this is the most effective. Less than 1 per 100 that are having sex for a year will get pregnant from vasectomy, tubal ligation, hysterectomy, IUD, or an implant. 2 to 9 per 100 will get pregnant from Depo-Provera, the pill, NuvaRing, or the patch. 15 to 24 per 100 from the diaphragm, the male or female condom, withdrawal, the sponge or the cervical cap, and about 25 per 100 will get pregnant using spermicides alone. Again, this is not taken into consideration also being careful with STDs. But if you're going to have a monogamous relationship with someone and you want to be responsible, you need to find the right form of birth control for you, and here are some of your options.